welcome to our channel. Today we're diving into an important topic, HIV testing and frequently asked questions. We're going to break down any stigma surrounding HIV and empower you with knowledge about your health. Knowledge is power, and when it comes to your health, it's always better to be informed. Alright, let's start with the basics. HIV stands for Human Immunodeficiency Virus. This virus attacks the body's immune system, specifically the CD4 cells, which are crucial for fighting off infections. Now here's why testing is so important. Early detection is key. In the early stages of HIV, you might not have any symptoms, or you might mistake them for something else, like the flu. This means you could have the virus and not even know it, potentially transmitting it to others unknowingly. Regular testing removes the guesswork. It gives you a clear picture of your health status. Knowing your status empowers you to make informed decisions about your health, your relationships, and your future. If you test positive, early diagnosis allows you to start treatment sooner. Early treatment is crucial in managing the virus, slowing down its progression, and preventing it from developing into AIDS, acquired immunodeficiency syndrome. Plus, when you know your status, you can take steps to protect your partners from contracting the virus. Remember, HIV doesn't discriminate. It can affect anyone, regardless of age, gender, sexual orientation, or background. So let's talk about the different types of HIV tests available. When it comes to HIV testing, we have a few different options, each with its own pros and cons. Let's break them down in detail so you can understand which might be the best fit for you. First up, we have antibody tests. These are the most common type of HIV test. They work by detecting the presence of antibodies, which are proteins your body produces in response to the virus. These tests are widely available and can be done in various settings, including clinics, community health centers, and even at home with self-testing kits. Think of antibodies like your body's defense team. When HIV enters the scene, your body sends out antibodies to fight it off. These antibodies can be detected in your blood or saliva, making the testing process relatively straightforward. Antibody tests can be done using blood samples or even with a simple finger prick. The finger prick method is particularly convenient for those who might be uncomfortable with needles or prefer a quicker, less invasive option. Some antibody tests can detect HIV as early as 2 weeks after infection, while others might take a bit longer. It's important to note that the window period, the time between potential exposure to HIV and the point when a test can accurately detect the virus, can vary. Next, we have antigen antibody tests, also known as fourth-generation tests. These tests are like the all-stars of HIV testing. They offer a more comprehensive approach by detecting both HIV antibodies and a protein called P24 antigen, which is part of the virus itself. The P24 antigen is produced in large quantities in the early stages of HIV infection, so these tests can identify the virus sooner than antibody-only tests. This makes them particularly useful for early detection. The cool thing about antigen antibody tests is that they can detect HIV even earlier than antibody-only tests, sometimes as soon as 18 days after infection. This early detection can be crucial for starting treatment promptly and reducing the risk of transmission. And finally, we have nucleic acid tests, NATs. These tests are the most sensitive and can detect the actual virus in your blood. They work by identifying the genetic material of HIV, making them highly accurate. NATs are usually reserved for specific situations, like when someone has very early symptoms of HIV or needs a definitive diagnosis. They are also used in cases where there is a high risk of recent exposure, such as in healthcare settings or for individuals with a known exposure to HIV. They're not as commonly used for routine testing because they're more expensive and require specialized equipment and trained personnel to administer and interpret the results. So which test is right for you? That's a conversation to have with your doctor. They can help you weigh the pros and cons of each type of test based on your individual risk factors, health history, and the timing of your potential exposure. They'll consider your individual risk factors and recommend the most appropriate test. It's also important to discuss any concerns or preferences you might have, such as the type of sample collected or the speed of results. Now, let's demystify the testing process itself. Understanding what to expect can help alleviate any anxiety and ensure you're prepared for your HIV test. Okay, so you've decided to get tested for HIV. That's amazing. Taking this step is a crucial part of taking control of your health and well-being. Now let's walk through what you can expect during the testing process. It's natural to feel a bit anxious. but knowing what to expect can help ease those nerves. First things first, you'll need to find a testing location. This could be a local clinic, a community health center, or even a mobile testing unit. Don't worry, we'll talk about where to get tested a bit later. There are plenty of resources available to help you find a convenient location. Once you're at the testing site, you'll be greeted by a healthcare professional. They are there to help you and make the process as smooth as possible. They'll ask you some questions about your medical history and sexual activity. This is to ensure they provide you with the best care and advice. Don't worry, everything is confidential. Your privacy is a top priority, and all information shared will be kept secure. Depending on the type of test you're getting, they'll either take a blood sample or a swab from your mouth. Both methods are quick and straightforward. The actual testing part is quick and relatively painless. Most people find it to be a simple and easy process. If it's a blood test, you might feel a small prick, like when you get your blood sugar checked. It's over before you know it. For oral swabs, they'll just rub a swab along your gums. Easy peasy. It's a gentle and non-invasive method. After the sample is collected, it's sent to a lab for analysis. The lab technicians will carefully examine the sample to ensure accurate results. The waiting period for results varies depending on the type of test and the lab, but it's usually within a few days to a week. During this time, it's important to stay calm and patient. You can choose to receive your results in person, over the phone, or even through a secure online portal. Choose the method that feels most comfortable and convenient for you. It's all about what makes you feel most comfortable. Your peace of mind is important, and there are options to suit everyone's needs. Now, I know the waiting period can be nerve-wracking, but try to relax. Engage in activities that help you stay calm and centered. Use this time to practice some self-care and remind yourself that you're taking a proactive step towards your health. Whether it's reading a book, taking a walk, or spending time with loved ones, do what makes you feel good. Let's address some common questions and concerns people have about HIV testing. It's natural to have questions, and it's important to get accurate information. I know there can be a lot of misinformation out there, so let's set the record straight. Understanding the facts can help alleviate any fears or uncertainties you might have. First question: is HIV testing accurate? This is a crucial concern for many. The short answer is yes. HIV tests are very accurate, especially when performed correctly and at the right time. Modern HIV tests are highly reliable and can detect the virus with great precision. Remember those different types of tests we talked about? Each type of test has its own specific purpose and accuracy level. Each one has a different window period, which is the time it takes for the test to accurately detect the virus. It's important to get tested at the right time to ensure the most accurate results. Your doctor will make sure you get the right test at the right time for the most accurate results. They are trained to guide you through the process and answer any questions you may have. Next question: is HIV testing confidential? Absolutely. Confidentiality is a cornerstone of the testing process. Your privacy is of the utmost importance. All your information and test results are handled with the highest level of confidentiality. Everything you discuss with your doctor and the testing process itself is strictly confidential. You can feel safe knowing that your personal information is protected. Your results will not be shared with anyone without your consent. This ensures that you have control over who knows your status. Another common concern: what if I test positive? This is a question that weighs heavily on many minds. It's important to remember that a positive HIV test is not a death sentence. Advances in medical treatment have made it possible for people with HIV to live long, healthy lives. With proper medical care and treatment, people with HIV can live long and healthy lives. There are many resources and support systems available to help you manage your health. If you do test positive, your doctor will guide you through the next steps, including starting treatment and connecting you with support services. You will not have to navigate this journey alone. Remember, you're not alone in this. There are many people and organizations ready to support you. Now let's talk about where you can get tested and what to do next. There are numerous testing sites available, including clinics, community health centers, and mobile testing units. It's important to choose a location that you feel comfortable with. Getting tested for HIV is easier than you might think. There are many places where you can get tested confidentially and discreetly. Your primary care doctor is a great place to start. They can order the test for you or refer you to a testing location. Many clinics and hospitals offer HIV testing, often with rapid testing options that provide results in as little as 20 minutes. You can also find free and confidential testing at community health centers and Planned Parenthood locations. Another option is home testing. Several FDA-approved home HIV test kits are available online and at some pharmacies. These kits allow you to test yourself in the privacy of your own home. No matter where you choose to get tested, the most important thing is that you do it. Knowing your status is the first step in taking control of your health. If you test negative, that's fantastic. But remember, HIV testing is not a one-time thing. It's important to get tested regularly, especially if you have new or multiple sexual partners. If you test positive, don't panic. Take a deep breath and remember that you're not alone. Reach out to your doctor or a trusted healthcare professional. They will provide you with support, resources, and a personalized treatment plan. Thanks for watching. If you found this video helpful, please like, share, and subscribe for more health-related content. Stay informed and stay healthy. Remember, knowledge is power, and taking charge of your health starts with understanding HIV and the importance of testing. Stay safe, stay healthy, and we'll see you in the next video.